Branchial cleft cysts, also called branchial cleft remnants or branchial cleft anomalies, are a congenital condition, that is, a condition present at birth in which tissue develops incorrectly on one or both sides of the neck. Branchial cleft cysts sometimes have openings on the inside or outside of the skin called sinus tracts. Fluid may drain from the openings. There are three types of branchial cleft anomalies: sinus tracts, fistulas, and cysts. Sinus tracts occur when there is one opening in the skin where fluid may drain out of a small hole in the neck. Branchial fistulas occur when one opening forms specifically between the skin and throat lining, that is the pharynx, draining mucus out of the neck. Branchial cleft cysts occur when there is no external opening and liquid cannot drain out of the neck. Then a collection of fluid forms. This leads to a formation of a branchial cyst, and it can occur on its own or with a branchial cleft sinus tract or fistula. There are four types of branchial cleft cysts. First branchial cleft cyst has a type 1 and a type 2. In type 1, there is an external opening above the jawline. In type 2, the opening to the sinus tract is lower on the upper neck but above the hyoid bone. But the internal opening in both type 1 and type 2 is in the external auditory canal. Second branchial cleft cysts are the most common type of branchial cleft cyst. They usually appear after a child turns 10. External openings to the sinus tract are on the upper side of the neck. Internal openings may form as well at the back of the throat near the tonsils. Second branchial cleft sinus tracts may also look like skin tags on the neck. Third branchial cleft cysts occur on the left side of the neck close to the thyroid gland and within the muscle attached to the collarbone. This type is less common than the first and second type. The muscle attached to the collarbone is the sternocleidomastoid muscle. Fourth branchial cleft cysts are rare. They most often appear on the lower left side of the neck. They are often misdiagnosed or unnoticed in children. Sometimes third and fourth branchial cleft do not have sinus tracts. This means there is no external opening for fluids to exit the body. Infections in these cysts can cause skin irritation in the area around the thyroid gland. Branchial cleft cysts and sinuses are congenital conditions. Why are they happening? What is their cause? Branchial cleft cysts are caused by unexpected changes during pregnancy. Often these changes occur around the 5th week of pregnancy when gill-like structures around the neck do not reabsorb back into the skin. Now, the presence of gill-like structures basically indicates that human beings and fish at some point had a common ancestor, which backs the theory of evolution. At the same time, pharyngeal arches, bands of tissue that develop into the head and neck, start to form. Later, these arches become bone, cartilage, muscles, and blood vessels. When these arches form incorrectly, they create empty spaces that fill with fluid and become cysts. Most of the time, these conditions are unilateral, that is, they occur on one side of the neck. When branchial cleft cysts are bilateral, that is, occurring on both sides, your child is more likely to have other congenital abnormalities, that is, conditions which are present at birth. Now, some of the symptoms of branchial cleft cysts and sinus tracts are: now, most of the branchial cleft cysts go unnoticed until your child develops an upper respiratory infection, like the common cold. Unless the cyst is infected, it is usually not painful. Possible symptoms of branchial cleft cysts and sinus tracts are lump or skin tag on neck or upper shoulder, bumps that become more painful with swallowing or grow bigger over time, swelling or tenderness on neck, fluid exiting neck from a small dimple or opening in skin. If the cyst is infected, possible symptoms include painful bump in the neck, trouble with swallowing, skin itching and irritation. If your child has any of these symptoms, you need to contact your nearest doctor, preferably a pediatrician or even an otolaryngologist. Branchial cleft cysts and sinus tracts are typically diagnosed just on the basis of a good history and a good physical exam. Sometimes people may also go for MRI or CT scans to find out the exact location of the cyst. Ultrasounds can also help figure out whether there is a fistula connecting the throat or ear canal. Currently, there is no medication that can treat branchial anomalies. If the cyst or sinus tract is infected, then the child or the patient requires antibiotics. Surgery is the most common treatment to permanently remove branchial cleft cysts and branchial sinus tracts. Most surgeons remove sinus tracts and cysts through a small incision in the neck, but because the length of the tract can span the entire length of the neck, another incision may need to be made, and typically this is known as stepladder incisions. This is done to avoid creating one long incision. In some rare cases, surgeons may be able to close off internal openings without creating incisions. Sometimes small tubes are placed during surgery to allow fluid to drain out of the skin. Usually, dissolvable sutures help to close incisions, but this varies from patient to patient and from surgeon to surgeon. In most cases, patients can return home on the same day as the surgery, but sometimes when there is a concern regarding a swelling in the neck affecting the patient's breathing, they might require to stay overnight at the hospital. No surgery is without risk. The risks of surgery related to branchial cleft cysts are as follows: damage to the nerves and blood vessels which lie very close to these cysts, infection in the area where surgery is performed. If an infection in the branchial cleft cyst is not treated before surgery, there is a higher chance that the cyst may come back later.